My daughter was under Medicaid because I wasn't making that much money. But now for the state, I'm making too much money, so they closed my daughter's case.
Like Rosemary, there are millions of families whose income is too high to be eligible for Medicaid, but too low to afford private insurance. But now they have another option.
If my daughter gets sick, now I know that I have an insurance that I could take her to a place and I know that she's going to be seen.
Rosemary is one of many parents who can provide their children with the doctor's appointments, medicine, and preventive care they need thanks to the Children's Health Insurance Program, better known as SCHIP, created by the Clinton administration in 1997.
The purpose of this bill is to cover working, what you would call almost the working poor, working class people who cannot afford insurance. But at the same time, those are people who are working already. Most of these people work in factories or have blue-collar type jobs that unfortunately do not offer insurance. So most of those people would not be able to afford private insurance on their own, and this bill helps them.
But millions of children are still not covered. That's why both parties came together in the last Congress in an effort to expand this program. The legislation passed both the House and the Senate, but it was vetoed by former President George W. Bush.
Unfortunately, a small group of Republicans in the House of Representatives did not allow for a majority vote, a two-thirds vote in the House in order to override that veto.
But a new Congress year has begun, and after a fair and lengthy review, the bill was once again passed in the Senate.
Before, children who were not born in the U.S., who were legal residents and were not born in the U.S., were not covered by the legislation. This legislation has been amended so that children who are legal immigrants will be covered now. And we are talking about 400,000 children who will be covered by the legislation now.
The legislation will enable states to cover an additional 4 million uninsured children by 2013, regardless of how long they've had their immigration status. And like Rosemary, these families will really appreciate all the benefits the program has to offer.
I think it's a good idea that they extended the CHIP program so that people could benefit from it.
Now, many see the signing of the legislation as the first step towards the promise of quality, affordable health care for all.
One of the most important things is that because of heavy opposition last year, legal immigrant children had not been included, but because of a determined effort by a lot of members in the Senate, including Senator Reid, we were able to include them.
Well, guess there are well-documented problems for Latinos getting health care. They are heavily uninsured. Given that there was a gap between employer health care and those programs that provide for poor people, was SCHIP a good way, an advisable way, an economic way to get care to those people who didn't fit in any of the existing programs? Congressman?
Oh, without a doubt. I come from Laredo, Texas, and according to the U.S. Census, Laredo is 94.9% Hispanic, the most Hispanic city in the whole country, percentage-wise. I authored the first CHIP pilot program in Texas at the Farias Elementary School. And the reason we did that was simply because, as you said, if you're poor, you'll get the Medicaid assistance. If you got money, if you got the resources, then of course you can get your own private insurance. But in the middle, you have the working middle class. And especially in an area like Texas, and I worked with then Governor Bush on this legislation. He also threatened to veto at that time because he thought the eligibility should be closer to 140%. Of course, we put 200%, but he eventually did back away from the veto, didn't do the same thing here in the U.S. Congress or when he was at the federal level. But we did that simply because we saw this need of a gap of people, and especially in a state like Texas, we have 1.4 million kids that have no coverage, probably the largest amount of kids in the whole country with no coverage in that category.
Michael Cannon, was SCHIP the answer, and was expanding it a good idea?
I think there's a myth that SCHIP is targeted just toward that group of people, the group of children that are too affluent to be eligible for Medicaid but unable to afford private health insurance. If you look at the children who are eligible for Medicaid when it was enacted in 1997, 60% of the children eligible already had private health insurance. So if 60% of those who are eligible, 6 out of 10 who are eligible already had private health insurance, you're not really targeting the program toward the uninsured very well. And the bill that was just signed into law by President Obama expands SCHIP to children in a group, in an income category where I think 77% already have private health insurance. So this is not about, SCHIP is not about targeting resources to children who are in need. It's actually enrolling a lot of people in the program who already have private health insurance, don't need government assistance, and that's why it's been estimated by Jonathan Gruber at MIT that SCHIP will cover 4 uninsured children, but it does so for the price of covering 10. And that's, I think, a bad deal even by government standards.
Would it have the perhaps unintended but surely undesirable consequence of having more employers pull out of coverage for children because they know their employees' kids can get SCHIP?
I think that's one of the reasons why, when the SCHIP rolls expand by 10 children, the number of uninsured children only falls by 4, because those other 6 people are either the employer is dropping coverage, or the family decides, well, I can get coverage free from the government now, so I won't have we won't pay for it ourselves. We'll decline the coverage that our employer does offer.